But the failure of forensic psychology doesn't stop there. As I continued into the world of forensic psychology, my professional concerns mounted. Not only does forensic psychology simply make up new forms of pathology, they also make up entirely new forms of therapy that they never describe in any book or article, called reunification therapy. I'm a clinical psychologist. My PsyD degree, rather than a PhD degree, means I'm a super focused clinical psychologist. My specialty is all forms of therapy and the solution of pathology. That's what a PsyD degree means. There is no such thing as reunification therapy. There is no book, no article, nothing to ever describe any basis or procedures for something called reunification therapy. It is a term used to cover the fact that individual therapists are simply making stuff up and have no idea what they're actually doing. This supposed reunification therapy that's so prevalent throughout forensic psychology is a snake oil remedy, pure and simple. Who knows what's in it, and it'll most likely kill you rather than heal you. Forensic psychology simply makes stuff up. It makes up new forms of pathology that do not exist in clinical psychology, and they simply make up therapy that equally does not exist in clinical psychology. They're just making stuff up, and is it any wonder they cannot solve pathology? But it does not stop there. Possibly the most egregious aspect of forensic psychology are the child custody evaluations they use to assess family pathology and make recommendations. There is zero validity to the conclusions and recommendations reached by child custody evaluations. Zero. And all psychologists know this. It has to do with an issue called inter-rater reliability of assessment procedures. Child custody evaluations have no inter-rater reliability, meaning that different custody evaluators can reach entirely different conclusions and recommendations based on the same data. If an assessment procedure is not reliable, it cannot, by definition, be valid. If you start pulling on the string of inter-rater reliability with child custody evaluations, all of forensic psychology regarding child custody decision-making will begin to unravel. The conclusions and recommendations of child custody evaluations are no more valid than a monkey throwing darts at a dartboard. And the monkey is likely to be a lot less expensive and a lot more entertaining. Child custody evaluations cost between $20,000 to $40,000 to complete for each one, and typically take between 6 to 9 months to complete. They spend hours and hours meticulously collecting information, all billable time. They spend hours upon hours meticulously writing reports describing the collected information, all billable time. Yet when it comes to what the family information means, they just make stuff up. Literally, the custody evaluators just make up their conclusions and recommendations, not necessarily based on any established professional knowledge base, constructs, or principles in professional psychology. As an expert consultant and witness in these high-conflict family cases, I've had the opportunity to review these custody evaluations, which are typically sealed by the court. They're bad. As a clinical psychologist, they're really bad. They are far, far below the standard of practice for assessment in clinical psychology. If the conclusions and recommendations of child custody evaluations are not valid, and if every psychologist knows this, why isn't anyone in professional psychology disclosing this? $20,000 to $40,000 per evaluation. There is a financial incentive in forensic psychology to remain quiet. A conspiracy of silence in forensic psychology. The fox is in charge of the henhouse. Someone needs to take a look at forensic psychology. Turn over the rock of forensic psychology and high-conflict divorce, and you'll find all sorts of deeply troubling, creepy-crawly things living under that rock. It's no wonder that forensic psychology can't solve pathology. especially the complicated family pathology of high conflict divorce. They're just making stuff up over there. While in Washington, we are meeting with the offices of our congressional representatives to request congressional hearings into forensic psychology and child custody decision-making in the family courts. Yesterday, we also delivered the petition to the American Psychological Association, asking that the APA convene a conference of experts to look into forensic psychology and child custody decision-making in the family courts. Today, we are holding a press conference asking the press to look into forensic psychology and child custody decision-making in the family courts. Pull the string of inter-rater reliability for child custody evaluations and it will start to unravel. Ask if forensic psychologists are required to have training in the attachment system. No. Ask if forensic psychologists are required to have training in personality disorder pathology. No. Ask if forensic psychologists are required to have training in family systems therapy. No. Ask if forensic psychologists are required to have training in complex trauma. The answer is no. Instead of knowledge, they allow themselves to just make stuff up, and it is destroying the lives of children and families. Parents are no longer tolerating the profound professional ignorance and incompetence in forensic psychology that is destroying their children and families. Clinical psychology is returning to court-involved high-conflict divorce. The world is changing. Professional ignorance and incompetence are no longer acceptable.